In important news for South Africans who suffer from cystic fibrosis, they will no longer need to look overseas in search of critical medication for this disease. It follows the Competition Commission's investigation into medicines manufacturer Vertex Pharmaceutical. The Commission was investigating allegations that Vertex has been engaging in exclusionary practices and excessive pricing in the provision of key drugs for the treatment of cystic fibrosis, which is a rare genetic disorder that results in the production of excessive mucus affecting the lungs and the pancreas. The Commission says it's now halted its investigations into Vertex following its commitment to the Commission that it would make the more affordable drug available for South African patients suffering from the condition. Rida Viljoen of the South African Cystic Fibrosis Association joins us for more. A very good evening to you. Thank you so much for your time. Perhaps let's start off here, just to get a broader understanding of what cystic fibrosis is and why this latest development is so significant.
Thank you very much for the opportunity tonight. I think we are very disappointed in the Commission for not looking deeper into this matter. The matter of the fact is that only 37% of eligible patients has access to this drug, and our state patients do not have access to this drug. So SACFA is deeply concerned and worried about this decision that the Commission reached, because we felt the Commission is the exact forum that we need to give the country a voice.
So what does that mean? What is the ripple effects that state patients don't have access to the drug? Does it mean that that they'll have to access it more expensive? What are the implications?
The implications is that our state patients do not use this drug because they don't have access. They cannot afford this drug. So Vertex Pharmaceuticals came to the table and offered a deal with high-end medical aid. So only medical aid patients on top-tier plans have access to this drug. And that ended up in a tally of 37% that can use the drug. There is no solution yet for our state patients. We are in negotiations. We are working hard to find a solution. And, tonight I just really want to implore our National Health as well as Vertex Pharmaceuticals to please come to the table and give access to our desperate patients.
What does this now mean for the desperate patients? And perhaps also expand a little bit on how cystic fibrosis impacts a person's life.
I personally endeavored to try and illustrate what cystic fibrosis looks like. In the end, I spoke to 6 patients pre-CFTR modulators. And I asked them, how often do you go to hospital? Are you admitted, or you sit in a waiting room waiting for follow-up appointments? In 6 patients for a year, we used 297 days sick leave to take care of cystic fibrosis collectively. After a year of CFTR modulators, Trikafta, we reduced that number to a significant 29 days. That's all. And that is the picture that I just really ask our National Health to look at, and also Vertex Pharmaceuticals. The exorbitant price is going to mean necessarily that state patients won't have access. So we will have to look at alternatives for our state patients to bring this drug to them. Our patients are dying because they don't have access. Our patients are in hospital and not in school. They are not completing their school careers. They are not, contributing adults because they are often in hospital.
So the treatment, is this a condition that can be cured, or is it one of a matter of life and death if one does not access the treatment?
So unfortunately, cystic fibrosis has no cure as yet. Trikafta is as close to a cure that we can find. So our mean average age in South Africa, I think, is 34. But studies have shown with access to Trikafta, we can expect a normal life expectancy. And again, I want to reiterate, it's not just a normal life expectancy, it's a life expectancy with a lot of depth and the possibility to go to school, to have a job, do normal things.
Yeah.
Before I used Trikafta, I was very ill. I was permanently on oxygen. I battled to do just a normal day mommy stuff. I started Trikafta, and it changed completely my whole life. So, this drug is very necessary to come to our state patients so that they can also breathe and live.
So this is a malfunction which causes problems with digestion. It interrupts how the body absorbs nutrients from food. But from what you're describing, your life was at a standstill here. You couldn't do much because of the impact of this condition. And what do you think needs to happen from this point onwards? I mean, you speak about the 37% of eligible patients who have access. How does this conversation reach greater heights so that it's accessible to all and not just a selective few who can afford it?
So I think, first of all, I would like to invite our community to please get in touch with us so that we can really rally our national health to help us get this drug. So please contact us at info@sacfa.org.za. And also, this is our personal plight to Vertex Pharmaceuticals and the Department of Health to say, can we please come around the table? Can we please figure out a situation, figure out a way for our state patients? It is critical that we move on this. Patients are dying daily because of this condition. And the longer we wait and the longer that we cannot decide who must make decisions, or we are unwilling to look at prices, I'm really sad to say, but, children are really suffering out there.
Very quickly, talk to us a little bit about the symptoms. How would one know that they have cystic fibrosis? Yes, it's a rare genetic disorder, but how would a person know?
I think one of the easiest ways to find out if somebody has CS is to taste their skin. We have very salty skin, so often we have coughs, sinusitis, clubbing of the fingers, and the malnutrition. So we often see babies that is, suffer from failure to thrive, they call it. And this baby really has brilliant feeding, but the baby just doesn't grow.
Very well. Thank you so much. Thanks for speaking to us about this evening. Of course, that important call being made by Rida Viljoen of the South African Cystic Fibrosis Association, talking a little bit about the importance of this life-saving drug.